A health alert at 4:30. We're seeing RSV and its spread ramping up across our region. A big concern for parents, especially those with infants. First Alert 4 told you just last night in mid-December of 2022, the positivity rate for RSV in Missouri was 6%, but now it's nearly double that at 11.4% this year. The most recent rate in Illinois is 12.9%, but it was 10.5% at this time last year. So for a clearer picture of RSV's impact, especially for those with infants, we're joined by Dr. Jason Newland, a pediatric infectious diseases physician. He's also with the St. Louis Pandemic Task Force. Dr. Newland, thank you for your time. And I'd just like to start with, what are we currently seeing in our area with RSV?
Yeah, thanks for having me, David. We're seeing a lot, right? We're seeing a lot of colds in our community, which for you and I, we have runny nose and cough. But for the babies, the infants, they get sicker and need the hospitalization. We're seeing a lot of infants in our hospital with RSV, and that's across the region.
We have a lot of parents out there watching this conversation. I have a 10-month-old at home. What are the symptoms of RSV that parents need to be on the lookout for with their baby?
Yeah, first, congrats to you and all those parents. Well, what the big ones is bad runny nose, copious runny nose, and often cough are the two common symptoms. They may or may not have fever. And usually when they're feeling that crummy, they're not eating well. Also, they might be breathing really fast. The infants at the greatest risk are those right after birth in that first 3 to 6 months of life are the ones that might be breathing so fast they need to be seen and maybe seen by a clinician and be hospitalized for more supportive care.
You know, maybe you have a parent at home, or maybe a family depends on child care. You've got a baby sick, or maybe there's a sick baby at the child care. How cautious should a parent be regarding RSV?
Well, RSV is it's just here. It's every season during this time that we see it. And it is a concern. And we have to do the best we can to try to keep people away when they're sick. You know, obviously, we all can wash our hands as adults. We can wear masks. We can do these things to protect. There's a lot of people. We need to have childcare. People need to work. So we have to do these. So we have some new prevention strategies for these infants. One is a vaccine that moms, when they're pregnant, can receive when they're 32 to 36 weeks gestation. It's a safe vaccine for the moms, and they get those antibodies, those protective cells that then get transferred to the baby and provides a lot of protection in the first 6 months of life.
You mentioned that vaccine. How young is safe enough to get that infant one of these vaccines? I think a parent concern for a lot of parents, right, is, you know, there's that age restriction, but you want to make sure your baby is safe.
Yeah. So one thing, this new, what we call an immunization, it's not a classic vaccine. It's an immunization that gives the baby those fighting antibodies. This thing is a medication immunization called nirsevimab or Beyfortus. Unfortunately, it's in short supply. We don't have enough, so it's being, kind of rationed to those at the highest risk. And so some pediatricians, clinicians might have it or may not. And those infants can get it right after birth up until 8 months. However, because we're in short supply, really our greatest prevention strategies are, one, moms being able to get vaccinated, and two, all the things we learned during the COVID pandemic put in place here. Wash your hands, wear a mask. If you're sick, stay home, stay away, do your best, especially around the youngest infants.
And you mentioned that we're being selective with who gets this vaccine. Can you remind everyone, why is there that shortage of this vaccine, especially this time of year when it's at its peak?
Well, we're lucky it's the first year we've had it, right? So this is the first year we've had it, and the company didn't know, right? Didn't know who was going to take it or not. And thankfully, I would say we have a lot of people understanding that RSV is bad, and it's bad for our little ones. So we want to make sure we can give them. So we just didn't make enough. And hopefully, and we're working on that next year, they're going to have a lot more so we don't have this same problem. But we have plenty of RSV vaccine, not only for pregnant women, but for those over the age of 60, that'll protect those over the age of 60 from getting really critically ill and potentially being in the hospital and dying, and also help them be protected so they don't give it to the little ones.
We've talked about the uptick that we've seen in our region. Has RSV season peaked, or is there more to come?
There'll be more to come. Whether we peaked and we've reached a lot more getting it, yeah, maybe, but we're going to see RSV through February for sure and into March. RSV lasts typically from mid-October, early November through March. It's a long season. So getting these things now will protect, and doing these things will continue to protect infants and others, through March. But right now we're at one of the heights of the season.
Like we've discussed, there is this push for mothers to get that vaccine while they're pregnant. But when you have the kid already in your arms, what else can you encourage parents to do? Because that vaccine is difficult to get. We've talked about the age recommendation. What are parents left to do?
Well, we're left to do with what we've learned during probably the best during COVID-19 pandemic was one is let's wash our hands. If we're sick, we shouldn't be touching the little ones, right? If you have someone that has a runny nose and cold and cough and they're just dying to see that newborn infant, this is not the time to do that. There's plenty of time to be holding and kissing and loving on that little one. So do that when we're around each other. If someone have colds, if we want to prevent it from going through the house so that others have it, wear masks. That works. Now it's harder. I understand that's harder, but that can be something especially to be done in the public. And so these things, washing hands, wearing masks, staying home when you're sick, will work in helping protect our babes.
You mentioned we could be dealing with RSV well into February. Is it too late to get vaccinated if you're able to get a dose?
It is not too late. It is not too late. If you're going to get that nirsevimab medicine for the baby, that'll last 5 months, and you can get it, I would give it. The moms, I think our best strategy right now is pregnant women. If you're a pregnant woman between 32 and 36 weeks of that gestation, that's the time to get it. And it's a safe, effective vaccine to protect the baby. And that's what's so important.
Is there anything that I have not been able to ask you or you have not said yourself, Dr. Newland, that you think is important for our parents to hear?
Hey, I think what's important is that this is the respiratory viral season. And so not only do we have RSV, but we have influenza, which there's a vaccine for, get that. COVID is around, there's a vaccine for, get that. This is the time. All of these things that I said that's not a vaccine, those other things, washing your hands, wearing a mask, staying home when you're sick, will work against all these viruses. And that's what we're going to deal with, and that's okay because we have things to help protect those most vulnerable, which is often those babies.
And are we okay to get those doses at the same time, or do we have to wait in between the RSV and the flu and the COVID?
Yeah, so the RSV, for the little ones, like they don't get their vaccines. They can't get their flu vaccine or COVID vaccine until they're 6 months of age. So they're going to get that early on. But otherwise, for those elderly that can get vaccines, you can get them all at the same time.
Wonderful. Dr. Jason Newland, a pediatric infectious disease physician, also with the St. Louis Pandemic Task Force. Thank you for your time.